Well, hello, everybody. We are back with the Ramp Real Access Motivates Progress podcast, but we're going to do it a little bit differently today. I have a guest host and I get to be a panelist today. So I would like to introduce you to one of my board members, Anna, and Anna will take it from here.
Okay. Hello, everyone. My name is Anna Zawadzki. I use she, her pronouns. I am currently in Boston studying social work and theology and ministry at Boston College. Today, I'm wearing a white sweater, blue jeans, and I'm a white female with brown hair, and I'm relatively short too, so I got that going for me. And today I will be talking about disability awareness and how those with disabilities are able to access healthcare in the United States. So I'm here with Tina, Greg, and Nick, who will also share their stories about what it's like to access healthcare with a disability and what we could do differently about it. So I will begin by passing on the microphone back to Tina for introductions.
Hi, everybody. My name is Tina Guenette. I am CEO and founder of the nonprofit RAMP. I am a white woman with white blonde hair with a black and white patterned shirt. I am paralyzed from the waist down, so I utilize a power wheelchair in my daily life. And I'm looking forward to this conversation. I will pass it over to Greg.
Hi, I am Greg. I have blonde hair and big red beard. I'm white. I use he, him pronouns. And I am wearing a cream color t-shirt. And I am coming to you of Minneapolis, Minnesota, where I live at work, and I am on the co-counsel of the Institute on Theology and Disability.
Should I go next? So, hello, my name is Nicholas Iwamoto. I use he, him pronouns. I am wearing a picnic shirt, blue and white. Let's see. I have hearing loss and I deal with anxiety, so I depend on my 2 hearing aids. And I am coming to you from Rhode Island. I'm working from home today, but I took 1 hour off for this.
Wonderful. Okay, thank you so much, everyone. So I'll go ahead and begin with an opening statement of the current situation today in the United States for individuals with disabilities. So it's been 35 years since the initial signing of the Americans with Disabilities Act, also known as the ADA. And the ADA is aimed to protect individuals with disabilities from discrimination. Yet, health equity for disabled individuals still falls short. In February of 2022, the National Council on Disability, also known as the NCD, released a publication that health equity framework for people with disabilities by calling out to the U.S. government that barriers continue to persist in accessing healthcare. Currently, there are 61 million people with at least one disability in the United States, ranking as one of the largest minority groups today. In an article I found from Lazzoni et al. In 2022, unearthed 6 problems that are prevalent in the U.S. healthcare system. The first is that there's scarce disability data collection for disability data collection for healthcare policy research. This means that without reliable data to depend on, healthcare policy would fall short in being able to provide services for individuals with disability. The second issue is the lack of accessible communication, such as effective telecommunication methods and auxiliary aids for patients within the healthcare system. So that means there's lack of enlarged print, spoken description, and sign language interpreters for patients who really need this. The third issue is the lack of accessible parking at medical facilities and healthcare staff, and lack of parking at medical facilities and lack of accessible medical equipment for individuals with disabilities. And the fourth issue is from a report where there's assumptions from the healthcare staff towards individuals with disabilities. There's a bias and stigma towards patients with a disability from the healthcare profession, and a study found that 82.4% of outpatient physicians reported that they believe individuals with disabilities have a poorer quality of life than non-disabled individuals. And this is actually really problematic because if we look at the Affordable Care Act under Section 5307, it authorizes federal funding to train healthcare professionals on disability competent care. Yet there hasn't been any evidence that this has been completed. The fifth issue is that Medicaid is not required to cover home and community-based services, and this causes the service to be way too expensive and varied within each state. And also, the wait list for, on average, is about 39 months to be able to qualify. And finally, the sixth point is the need for non-discriminatory design for private health insurances. And if we look at the ACA in Section 1557, there are age limitations. For instance, there's an age limitation in accessing hearing aids, and there's also a limitation in covering for individuals with the autism spectrum. So now I will go into the questions. The first category of questions will cover with disability justice and healthcare ethics. And so I'm curious, what does healthcare equity mean to you? And I'm curious what our panelist, Nick, would have to say.
I actually hadn't heard of this term before, so I quickly did a little research yesterday.
Mm-hmm.
And the things that stood out to me were intersectionality. How does being a gay man with hearing loss and anxiety go through society when I'm always so anxious about how am I going to handle this? How am I going to, I'm so sorry. How am I going to handle going to certain locations where maybe I'm a little scared for my safety? And I also think about interdependence, where with my hearing loss, it's all about, am I going to be working with someone who is going to work with me? Are they going to give me that extra patience I need to repeat themselves? Maybe speak slower, maybe give me handwritten notes, depending on what I need. Thank you.
Yeah. Greg, do you have any thoughts about this question? What does healthcare equity mean to you?
Yes, as someone who probably has cerebral palsy that affects my speech, and I don't know what my disabilities are, but I think I have cerebral palsy. I am neurodivergent. So healthcare equity means that, like, when I go into a setting that or when other disabled people go into a setting that, like, we are believed, we are taken seriously, we aren't. I know so many people who suffer from chronic pain and who are not believed. And I understood, I respected, and healthcare equity means that we have access and the ability to get good services no matter who we are, no matter, and I think Nick had a great point about intersectionality, as that especially that for Black women with disabilities, it's much harder for them to get services and to be believed. So, so that equity would be the ability for us to all, no matter our race or the type of disability, gender expression, to be able to access adequate and health care. But we are a long ways from that in this country.
Yeah, well said. And I love that the both of you touched upon intersectionality. And for the audience, intersectionality looks at the multiple variables that applies to a person's life. So we're looking at not only their health status, but we're looking also at the social environment and policies and economic variables, education. So there's a variety of ways to look at an individual. And this is really important, as Greg mentioned, that today it's hard for individuals to have that sense of belief. And I'm curious for Tina too. I wanted also to hear your thoughts. What does health equity mean to you?
Health equity means to me is just having the accessibility. There are so many doctor's offices or hospitals that we can't even access from being in a wheelchair. There's no wheelchair scales at most doctor's office. What's the first thing you do when you go see your PCP? They weigh you and take your blood pressure. Weight has a lot to do with it. Dentist's office, a lot of them are not accessible for us, those in a wheelchair. A lot of your healthcare depends on what your mouth is like and, your dental issues. So access is a huge thing for accessibility that people don't understand, that just because it's a doctor's office, which should be accessible, is not.
Right. Yep. And well said, Tina, because it's surprising too from that article I mentioned from the National Council on Disability that there are barriers to accessible parking. So bringing a van to a medical facility is a challenge within itself. So just even getting to the place of care as easily as possible is a barrier.
And not just the parking part is a barrier. It's those who may not drive or don't have their own van getting an accessible ride or getting transportation to the doctor's offices on the doctor's schedule. Because sometimes, the doctors make their own schedule and then you can't get a ride for that schedule because nothing's available. There's so many barriers extra for us that people don't understand.
Yeah. So I feel like going off of that point leads to this next question. What type of obstacles in healthcare that you think are easily avoidable? We talked a little bit about accessibility and transportation, and the article mentioned about the lack of accessible equipment. And I remember Nick touching upon communication. Is there anything else that could be easily avoided to improve healthcare, if that makes sense? What are your thoughts, Nick?
This is always the hard one because accessibility needs are always different per each person. And so what I need is absolutely different from what other people need. But with my hearing loss, one of my biggest things is I go to the waiting room and I am always staring and watching. Where's the person calling my name? Did they say my name? Did they say someone else's name? How many syllables was that? and I just changed my primary care, and they have this very loud AC system, and I just can't hear in that room. And so for me, what I really need right now is sometimes I need the doctors to take me to a quieter room, and I need them to know, hey, you have to come tap me. You have to come say, hey, we're here for your appointment, rather than just calling out my name and looking around. Yeah, thank you.
Yeah. Well, what about you, Tina? What do you think would be easily avoidable in healthcare?
Easily affordable in healthcare is if, like, every 5 years we're up for a new wheelchair. If healthcare just paid for our wheelchair, where we didn't have the stress and anxiety of going through the entire process of I'm 2 years later into getting my wheelchair that I should have gotten 2 years ago, and I still am no closer than I was 2 years ago. But most people, their wheelchairs will break. They'll fall out of their wheelchairs. They'll end up in nursing homes. They'll end up in rehabilitation. If they would have paid for our wheelchair up front, they would have saved 3 times as much money paying for everything else that we need while we're fixing it.
How about you, Greg? What do you think is easily avoidable in healthcare?
I think what Nick and Tina said are great. I think something I would add is competency and different types of disabilities for doctors. I don't think doctors are prepared well. In medical school to deal with disabled people, and a lot of the discrimination we face just come from ignorance. I feel like since we are a large minority of the population, I think just competency and how to deal with people who have different disabilities will be great for doctors and nurses to have.
I was just looking at it's so interesting because as each person was talking, everything from the research that I've done is really it points to the evidence that there's a lack of training for doctors. There's there's a lack of humility, it seems, from seeing persons for who they are and being able to communicate with them effectively, and not providing the right types of equipment or assistive devices to live life as easily as possible. And so I just wonder now, how are you trying to live a healthy life today? Um, can you take it away, Tina, for this question?
Well, I'm living my best life because I make my own way. We find ways to make it work for us. They might not be the best ways. There might be a lot of ways earlier, but the best thing to do is keep trying. Don't give up. Keep getting out there. Keep, putting yourself out there. Eventually, people will see you for who you are and what you can do, and realize that the disability is not a negative. It's absolutely a positive. My wheelchair gives me wings. I'm not bound to anything. I couldn't do half of what I do if I didn't have my wheelchair.
How about you, Nick? How are you trying to live a healthy life today?
So for me, I feel like most of my health is always about my anxiety and making sure I get out of the house and try to constantly be seeing people and socializing, even though with the hearing loss, it can make it quite exhausting. It can be quite an effort, and but it also means like trying to be an extrovert, even though I'm an introvert at heart. but I'm part of an LGBT running group that we have a ton of walkers at, and it's really just anyone who wants to be there. It's a social group for running and walking and exercising. Um, that's how I keep getting myself out. And as I've gotten a little more confidence over time, I found Tina and I was like, oh my goodness, I had never heard of this. How can I learn more? How can I join in? And here I am today. Now I'm trying to practice more. How can I get more involved?
Yeah, that's amazing. And how about you, Greg? How are you trying to live a healthy life today?
I think that is a good question, and Furo's cat. People who are watching this can't see, but healthy life is in quotes, and I think that is important. Yeah, I think healthy life means for me um, knowing myself and knowing my body, and I think that I think being in community with other disabled people have given myself a new perspective on being disabled in a very ableist world. So I feel like I've learned how to love myself and my own body in ways that I never had before because I'm in such a good community of people who are we have varied disabilities, but we are just trying to help each other live our best lives. I think to have a healthy life, you need to love your body and love, um, yeah, live and look for ways uh, to further and dwell into the body. I think because of that, I am the healthiest I've ever been. Uh, in some ways, although different health indicators might say other ways, but I am living life right now in ways I never loved life in the past.
That's so beautiful, Greg. Thank you so much for sharing. A disability, it should not be looked at in a fearful way at all. I myself also have a disability and really appreciate what I can do. And so it's truly amazing of what disability can offer. It's not a superpower, but it's just an amazing thing that reveals there's so much more to life. Um, and so a question came to my mind that I didn't write out, but I just wonder what are some things that you would like for a healthcare provider to know when it comes to addressing your health, whether or not disability is involved. And I would like Nick to first answer.
Um, that's a good question. For me, I guess a lot of patience, and I guess a sense of not being rushed. Growing up, it was always with the medical records, the doctors are behind their computers, they're typing it out, and they have to do data entry as quickly as they can, run through 20 billion questions. And as an anxious kid with hearing loss, I didn't always speak up. I just kind of said yes, yes, yes. And I don't know if I always heard all of the questions or I always took the time to process things. So now I actually notice when a provider is sometimes late, and I always tell myself, if they're late, that means that they're probably giving those patients who need the extra time, who can't be rushed, who are asking really big questions that they really need the help with. That's probably what's taking them longer, in addition to all the other things that could be holding them up. I think patience with me is a big one, giving me time to think about things and making me feel safe, making me feel like if I misunderstood something, oh no, it's written down for you.
Right. Yeah. How about you, Tina?
The one thing I think I'd like them to know is I'm more than my disability. A lot of the times when I go to the doctors, they want to talk about everything that's related to my disability. But I'm a woman in my 50s. You know what I mean? I have menopause. I have other things going on. You know, the bottom half of me, doesn't function correctly, but the rest of me runs like a normal person. Like, think about other symptoms, and I have other issues other than related to my disability that they forget that they want to talk about the disability, but they don't want to talk about the normal things that go on in our lives and how the challenge of us dealing with those things going forward.
Right. Yeah. Thank you. And how about you, Greg?
I am a bigger guy. So I want my doctor. I look for doctors who are informed about health at every size. Because I don't think health is always a indicator of weight. And I want my doctor to talk to me about other things besides my health. Besides, I want my doctor to talk to me about other things besides my weight, and I want my doctor to be informed that just because we are like, because I might be overweight, that doesn't mean I'm necessarily unhealthy. And also, I want my doctor to, yeah, I would like my doctor to have some competency in how to talk, relate with disabled people.
Yeah. So what I just heard that there's obvious ways that I apologize for the light. Obvious ways for doctors to address healthcare that don't primarily focus on the physical appearance of someone or relating it back to disability as the prime subject of the reason someone is seeking medical attention. And also just like soft practices, how to be having appropriate bedside manner, being attentive to the person's needs and ways of communication, and being patient with someone too. So I just wonder, to wrap things up, is the question, what would you change in healthcare? What is one thing that you would like to see that can be changed in healthcare today? And I'll take it over to Tina.
Oh God, the one thing I changed so much, but the one main thing again, accessibility. It's so important. I mean, I go to the doctors. I can't get on the examination table. I can't sometimes get in the room. I can't be weighed. That if they made the offices accessible, I'd feel more welcome. I'd feel more that I belong there. That I feel that I could open up more. I think accessibility would be my top priority.
Okay, so physical accessibility and accessible medical equipment. How about you, Nick?
There was one appointment I had where they sent out a questionnaire before the appointment. They said, tell us like what you would like the doctor to know before you come. And in there, I was able to say, I have a hearing loss. Please remember, I have a hearing loss. And it was the one time I kind of felt safe. I kind of didn't think I have to remind every single person I come into, I have a hearing loss. You have to look at me for me to hear you. If I'm not looking, I might not be hearing you. And it was nice to be able to have that all prepared and start the discussion early. Maybe the doctor could have read the notes early and then said, oh, we have this here that can help you. I will be sure to hand out notes so I don't spend the whole appointment stressing and worrying about it.
Yeah. So the sake of not having to remind medical providers and just making sure that when you're entering a space, it's basically disability approved and you feel certain that the person you're going to see on that medical visit is well aware of what you are experiencing in your day-to-day. And how about you, Greg?
Easy. The main thing I want to change is we should have nationalized health care in the country. It is sad that we are the only industrialized country in the world who doesn't have naturalized health care. Every other country that is in that grouping has it, and we don't. And it's not socialist, it's not communist. That other democracies have it, and it isn't the be all and all, but I think we would have we we would have a better quality of life overall in this country if people disabled and non-disabled people had better access to health care, and we don't have it under this pay for the private model. And there are some trade-offs, but the biggest thing is people are happier and thrive in countries that have this. It's really pathetic and disgusting that we don't have it in this country, and the field marketing under about it is actually killing people every single day, killing disabled and non-disabled people. So yeah, that is the biggest. That is one of the biggest injustices when we talk about health care, and that would benefit people, disabled people by far, and probably prevent people from acquiring disabilities too, because I think there are some things where sometimes where people become disabled because lack of health care only could have prevented some occurrences of disabilities.
Yeah, you make such a strong point that healthcare should be easily accessible, and making it accessible helps everyone, and it prevents anything else from being like what you mentioned would be like secondary characteristics of health that can occur. And it shouldn't stray away people from accessing healthcare because of cost, from lack of access. We should be able to have the opportunity to easily access healthcare when we really need it. And so I will conclude the panel with that question, with that answer, and hope that this has raised awareness to everyone about what it's like to access healthcare in the United States today for those with disabilities. So I will pass the mic back over to Tina now.
Oh, thank you all so much for being here today. Anna, what a fantastic job and an important topic that you covered. You had a great collection of people with invisible and visible disabilities talking, and there were so many intersections to all of us and so many differences to all of us. So the conversation was incredible. So thank you all for being here. Thank you, Anna, for raising this topic and hosting this great event today. If you guys want to see more of this, visit our website, www.rampisinclusion.org, and we welcome you all back. And as I always say, don't just sit there, make a difference. Have a great night, everyone.